All right. It looks like we've gotten the bulk of the people in the waiting room have gotten in. Again, welcome. For those of you that haven't been in a webinar before or I haven't run across, I'm Dr. John Lohr, Vice President of STEM Education with Science Olympiad. Super excited that you could join us for this Thinking Thursday workshop on anatomy and physiology. I've got a fantastic presenter that I'm sure you guys are going to get a bunch of interesting tips and tricks and ideas from when it comes to this event. Just a couple of housekeeping things. Want to remind everybody that yes, this webinar is being recorded. You will receive a link to it. And it will also be posted on our Science Olympiad YouTube channel. I expect hopefully you guys will get the links, try and get the links out tomorrow before the weekend, and it'll go up on YouTube either over the weekend, early next week. If should you have any questions, if you look down in the toolbar on the bottom of your screen, you should see a box with a question mark in it. It says Q&A under it. That's where you can enter your questions. We will not be, we're going to do our best to try and answer questions, but there's a chance we may not get to answer everybody's question. If there's some good ones still outstanding or there's some really important ones outstanding, we'll do our best to get answers posted or get a list of responses for you when we put up the posting on the YouTube channel. Should you run into any technical difficulties or you have a question like, hey, sound cut out, oh, I think my screen froze, that kind of thing, you can send us those messages in the chat and we'll get back to you and let you know what's going on. All right. If we're all good then, so without further ado, I would like to introduce you to our speaker tonight. It is Sarah Hoagland. She is a research assistant at the University of Nebraska-Lincoln in the Department of Anatomy and Physiology. Correct me if I'm wrong, Sarah, you're an event supervisor for the state of Nebraska when it comes to event anatomy and physiology. And you are also a past anatomy and physiology competitor with Science Olympiad. Am I correct?
They actually didn't have anatomy and physiology when I was in Science Olympiad.
But she is a past Science Olympiad competitor. So she has been in your shoes, though not, unfortunately, not with this particular event. But at this point, I'm going to turn you over to Sarah and her capable hands. So Sarah, please feel free to take it away.
Thank you. So again, my name is Sarah Hoagland. I am a research assistant, as John said, at the University of Nebraska. I'm also the head anatomy TA at the University of Nebraska. So I teach 2 of the anatomy labs, and I also lead the donor dissections here at UNL. I was in Science Olympiad way back when I was in middle school and high school. And then I was the anatomy and physiology event supervisor for Nebraska many years later. So it's really full circle for me here. This year, the anatomy and physiology event focuses on the integumentary system, skeletal system, and muscular system. But today, I know we don't have super long time, so I'm going to give a brief overview of a couple of topics related to just the skeletal system. And again, feel free to ask any questions. I'll try to keep an eye on the chat, but well, yeah, I'll try to keep an eye on the chat. Feel free to ask any questions if you have them. I'm going to share my screen now. Bear with me here. Here we go. Okay.
All right. You're looking good, Sarah.
Perfect. Thank you so much. Okay, so to get started, how do I go to the next slide?
You should be able to tap your
Got it.
arrow keys.
Sorry, technology is not my strong suit here, so might have issues later, but we'll see. So to get started, there are many functions of bone and just the skeletal system in general, including support, so providing a hard framework to support the body, movement and leverage, so skeletal muscles will attach to bones via tendons, and use leverage to move the body and body attachments. Protection, so for example, bones of the skull will protect the brain, and ribs will protect organs of the thorax. So we also have mineral storage, for example, calcium and phosphate. Blood cell formation, so red bone marrow is the site of hematopoiesis, which is blood cell formation. Energy storage, for example, yellow bone marrow is the site for fat storage, as well as energy metabolism. So cells within bone called osteoblasts will secrete a hormone called osteocalcin, which then stimulates the pancreas to release insulin, which then functions to reduce blood sugar levels. So there are many functions of bone and the skeletal system in general. And then going a little bit further into just general bones, most bones have a more external layer and a more internal layer. So the external layer is known as compact bone, which consists of osteons, and the more internal layer is known as spongy bone, which consists of trabeculae. And trabeculae is the location of bone marrow. I think of it kind of like water in a sponge. So spongy bone. So the sponge itself is the trabeculae, and the bone marrow would be like the water inside of the sponge, filling the gaps. So on the left image here, can anyone tell me what bone they think this might be?
All right, guys, why don't you go ahead and throw that in the chat?
Anyone have a guess?
So we've gotten long bone, femur, bunch of femurs are flooding in right at the moment.
Well, everyone so far has been correct, so that's awesome. The femur is a long bone, so the femur is the major lower limb bone of the upper leg. So yeah, that's a femur. And you can see that the kind of external portion, it looks more like a thicker white. That would be the compact bone, and then the more internal portion with those kind of that like porous area, it looks like, that would be the spongy bone. All right, so now we're going to look at kind of like a blown up version of the image we saw on the previous page. So this image is a microscopic view of compact bone where we can see the individual osteons. So this is an osteon right here. Osteons are the functional unit of compact bone, and they run parallel to each other and to the long axis of the bone. And they also, so they cause the stiffness of long bones and help them to resist bending. They also help to resist the impact of different fractures. And osteons are also not static, meaning their arrangement can change and shift over time. Compact bone is highly vascularized, meaning it has a blood supply and contains blood vessels. Blood vessels travel through the osteons. So for example, this central portion of the osteon, it's kind of a darker color in the middle. This is known as the central canal. The central canal is a passageway for blood vessels. And at any given time, about 3 to 11% of the blood in the body is found within the skeleton. So I think that's pretty neat. All right, next, we have two images here. They are photomicrographs of spongy bone. So again, the bone marrow within a bone is located in the network of the bone trabeculae. Here we can see the difference between yellow bone marrow and red bone marrow. As I mentioned earlier, yellow bone marrow is the site for fat storage. So we can see within the trabecular bone, which is this darker pink color, we have these adipocytes, which are also known as fat cells for the yellow bone marrow. And then the red bone marrow on this side, we also have the trabecular bone shown in pink. And then within that, we have the blood cells. So that's just kind of an example of how spongy bone may look different under a microscope. So bones are classified according to their shape. We have long bones, short bones, irregular bones, and flat bones. So long bones, again, like we said earlier, femur, good job. Short bones, we have, for example, carpal, which would be bones in the wrists, flat bone, the frontal bone, which is a bone found in the skull, and then an irregular bone, such as a vertebra, which is along the spine. There are also sesamoid bones, which are a special type of short bone that are found within a tendon. So they're formed within a tendon. An example of that would be the patella bone. So the patella bone is considered a short bone, but more specifically, it's considered a sesamoid bone. And then we also have sutural bones, which are another special type, and they are a special type of irregular bone. And sutural bones are also known as Wormian bones, and they're found within the sutures of the skull. And then moving on, so bones have many superficial surface markings, and there are 3 general types of these bone markings. First, we have projections that are sites for muscle and ligament attachments. So, for example, we have like a crest, trochanter, line, tubercle, process, epicondyle, etc. A more specific example would be the iliac crest of the os coxa bone. So that's an example of a projection that's a site for muscle and ligament attachment. Next, we have surfaces that form joints. So a head, facet, condyle, etc. An example of that would be the condylar process of the mandible bone. And then lastly, we have depressions and openings. So structures such as foramen, groove, notch, sinus, fossa, etc. An example with this would be the foramen magnum of the skull. So before we look closer at a few specific bones, I first want to overview the skeleton and how the 206 bones of the skeleton are grouped together. They're grouped into the axial skeleton and the appendicular skeleton. The axial skeleton contains 80 bones that support the head, neck, and trunk. The axial skeleton protects the brain, spinal cord, and thorax. So heart and lungs are contained in the thorax. Bones of the axial skeleton are arranged into 3 different regions. We have the skull, vertebral column, and thoracic cage. The appendicular skeleton, however, consists of bones of the upper limb and lower limb, as well as the pectoral or shoulder, as well as the pelvic girdles. So girdles help to attach the limbs to the axial skeleton. So now we're going to get into a little bit of a closer look at the vertebral column. Vertebral column. The vertebral column is also known as the spinal column or spine. The vertebral column extends from the skull to the pelvis, where it transmits the weight of the trunk to the lower limbs. The vertebral column surrounds and protects the spinal cord. It provides attachment points for the ribs as well as muscles of the neck and back. In the fetus and infants, the vertebral column consists of 33 separate bones known as vertebrae. But beginning in adolescence, the more inferior 9 of these vertebrae will begin to fuse. And then by age, by age 30, the more inferior 9 bones are fully fused. And those 9 fully fused bones will form the sacrum and coccyx. So sacrum is here in green and coccyx is the bone here in pink. The remaining more superior 24 bones will remain individual, and they're separated by structures called intervertebral discs, which are little discs of cartilage, and they help to cushion the spine. And then the spine is divided into 5 major regions. So from superior to inferior, or top to bottom, we have the cervical vertebrae, thoracic vertebrae, lumbar vertebrae, sacrum, and coccyx. So there are 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. A way to remember that is meal times. So you eat breakfast at 7 a.m., you eat lunch at 12 p.m. and dinner at 5 p.m. So that's kind of a trick to remember those. In an adult, the sacrum is composed of 5 fused vertebrae, whereas the coccyx is composed of 4 fused vertebrae. And besides the 7 cervical vertebrae, 5% of people have some kind of variation in the number of vertebrae in the more inferior regions. So for example, they may have like 5 fused vertebrae in the coccyx instead of 4, that kind of thing. So in 5% of the population, you might find some of those variations in number. So the 5 different regions of the vertebral column make up 4 curvatures. You can see in the middle image, showing the lateral view of the spine isn't straight. You have many curves. These curves allow the spine to act more of like a spring and less of like a rigid rod. And that just helps to increase the resilience and strength of the spine. So from superior to inferior, again, we have the cervical curvature, the thoracic curvature, the lumbar curvature, and the sacral or pelvic curvature. So you can kind of tell that these names kind of correspond with the name of the bones that are found there. So that's a good way to remember those. So in a fetus, the spine is one single curve. The cervical and lumbar curvatures, which are opposite to that single curve seen in fetal development, will become defined in the first 2 years of childhood. The curves that resemble development are known as primary curvatures, whereas curves that are opposite to development are known as secondary curvatures. So the thoracic and sacral curvatures are primary, and the cervical and lumbar curvatures are considered secondary curvatures. So the cervical curvature will become pronounced when the baby starts to lift its head. So that's around 3 months of age. And then the lumbar curvature will become pronounced when the child begins to walk, which is around 1 year. So from anterior to posterior abnormal exaggerations in the spine. So again, anterior is kind of like front of the body, posterior is back of the body. So anterior and posterior exaggerations of the spine will result in different clinical conditions. For example, kyphosis is an exaggeration of the thoracic curvature. So this is kind of an example of what kyphosis would look like in a person. And then lordosis is an exaggeration of the lumbar curvature. And again, as those 2 conditions that we just looked at, kyphosis and lordosis, those are anterior and posterior abnormal exaggerations of the spine. Scoliosis is the lateral abnormal exaggeration of the spine. So that would be 10 degrees or more, either to the right or left lateral side. So scoliosis, this image, you can kind of see it on the back of an individual. It's most common in the thoracic region, but it can occur in other regions as well, shown on the image on the right. So we have thoracic, thoracolumbar, lumbar, and then a double curve as well. There are also different variations, but those are just some examples. So now we're going to look at the similarities and differences between the different vertebrae, starting off with the typical cervical vertebrae.
Hey, Sarah?
Yes.
Sorry to cut you off, but 2 questions came into the chat.
Oh, yeah.
They're kind of bigger picture ones that we might want to tackle before you get into the specifics of the vertebra.
Yeah, no problem.
First one is, it's a question from Kimberly. She asked, does everyone have 206 bones, or can that vary, like people having one more or one less?
Yes, it definitely varies. So for example, some bones, when you're at birth, those bones may not be developed, so they may start as cartilage and form over time. Also, some people are just born with an extra bone or one less bone. It just kind of depends. Sometimes you don't even know that you have an extra bone or one less bone, or a different variation. They may not cause problems. Other times it may cause a serious problem. So if you have an extra vertebra, for example, that may cause a serious issue. It just kind of depends on the person, but yeah, it's actually very common.
Okay. And then there's a question from I think it's a Binda, and apologize if I got that one wrong. The question is, what if people can move their thoracic region on command? Is there a special name for that trait or that ability?
Thoracic region on command.
Yeah, I'm assuming that they can kind of, I guess they were what they're referring to is like being able to shift or can deviate a particular spot of their thoracic vertebra.
Yeah, I am not sure. That's a really great question. That would be something that I would need to look up. Yeah, I do not know.
All right, we'll do some more research and see if we can't get you an answer on that one.
All right. I'm going to move on then. So we're going to look at the typical cervical vertebrae. So typical cervical vertebrae would be C3 through C7. So vertebrae are named according to their position. So the first cervical vertebra in the spine would be C1, and then the second would be C2, and so on, if that makes sense. And all of the vertebrae are named in that way. So typical cervical vertebrae are C3 through C7. And there are many bone markings and structures on the vertebrae, but I'm just going to go through a few. And we're going to just start off with, so first, the most posterior structure. So I put these labels here. We have posterior and anterior. Again, posterior is like the back of the body. Anterior would be more like the front of the body. And we are looking at this bone right now from a superior view. So we're kind of like looking down at it right now. Superior view. So we're looking down at it. First structure that we have is the bifid spinous process. And this is the most posterior structure. The root bi means two. So think of it as a two-spined process. So it's a good way to remember it. All of the typical cervical vertebrae will have a bifid spinous process except C7. C7 does not. Next, we're going to look at the superior articular facet. So this is a structure found on only the superior surface of the bone. And then the superior articular facet will articulate. So the word articulate means to form a joint with. So it will articulate with the inferior articular facet of the vertebra just superior to it. And I know that was kind of confusing. So for example, the superior articular facet of C5 will articulate with the inferior articular facet of C4, if that makes sense. So on the opposite side, on the inferior side of this bone, we have an inferior articular facet. So that's just a structure that you can see on the superior side, and then again, reverse on the inferior. We also have transverse foramen, and we have a transverse foramen on either side. So the plural would be transverse foramina. And then transverse foramina are unique to cervical vertebrae. So that is a pretty distinguishing feature of cervical vertebrae. And you'll find vertebral blood vessels will travel through these structures, and those vertebral blood vessels will supply blood to and from the brain. And then lastly, we have the centrum or body, means the same thing. And that's the most anterior large structure on the bone here. So now we'll get into the unique cervical vertebrae, which are C1 and C2. So C1 is named Atlas and C2 is named Axis. The way I remember this is T comes before X in the alphabet. And that's just what I tell students, how I remember it. But both the Atlas and the Axis have a superior articular facet on the superior surface of the bone. And they also both have transverse foramina, which again is a very distinguishing feature of cervical vertebrae in general. The Atlas does not have a body or spinous process. So it doesn't have that spinous process on the posterior side, and it doesn't have that body on the anterior side. But the Axis does have a bifid spinous process on the posterior side, and then it also has a body on the anterior side. You can see it a little bit from the superior view, but it's more visible from kind of like the lateral or anterior view on the bottom of the screen there. And then the Axis also has a very unique feature only to that bone called the dens or odontoid process. And this structure will extend superiorly from the bone, and we'll look at that a little bit later as well. So moving on to the thoracic vertebrae, that would be T1 through T12. Unlike the cervical vertebrae, the thoracic vertebrae, they only have a spinous process. So take off the bifid, we only have one kind of spine projecting from the bone. We don't see those two little ends like we did earlier. And then the thoracic vertebrae also have a superior articular facet. I will note that the superior articular facet on the cervical vertebrae, those are going to face posteriorly. So you can see those surfaces on either side. It's a paired structure. Those extend posteriorly, whereas we saw earlier the superior articular facets on the cervical vertebrae will extend more superior. And this is a very distinguishing feature of the thoracic vertebrae. So it'll help to identify between thoracic vertebrae and lumbar vertebrae. And then lastly, the centrum or body is also present in thoracic vertebrae. So now moving on to lumbar vertebrae, again, posterior, anterior. The lumbar vertebrae also only have a spinous process, just that one spike on the posterior side. And the superior articular facets are present as well on both the right and left side. But one thing to note here, the superior articular facets of the lumbar vertebrae are facing more medially. So I can show the thoracic again. So thoracic face posterior, lumbar face medially. And I think that is really helpful when trying to identify the different bones. And then lastly, same thing, the centrum or body. Another way to distinguish lumbar vertebrae and thoracic vertebrae, lumbar vertebrae tend to be a lot larger than thoracic vertebrae. So that's another way to tell. It's kind of difficult to show that on PowerPoint, but we will look at some real bones later and you can tell the difference. So lastly, we're going to look at the sacrum. So the sacrum is one bone in adults, whereas in children, it's 5 fusing or unfused bones, but in an adult, it's just its own bone. It's not a paired bone. And the sacrum in males and females are very different. And it is one way that you can identify a male versus a female by just looking at the bones. So the male sacrum tends to be longer and more straight versus the female sacrum tends to be shorter and a bit more curved. And there are other distinguishing features as well in like the pelvic region, but generally the sacrum, if you only have a sacrum to look at, you can still tell the difference between a male and a female. Those differences are due to, so females can give birth to children and males can't. So that's why the structures in bones are different sizes and shapes and everything. So now we're going to move on a little bit. Does anyone have questions before we move on? Just want to.
Yes, sir. There's a couple here.
Okay.
So Kimberly asks, can you be born without transverse foramina? And if so, what's the effect?
I am not sure if you can be born without transverse foramina, but I would say that the vertebral vessels are extremely important. They supply blood to the brain. So I would assume that if you are born without those structures, it wouldn't be viable. But I don't know if that's possible.
Okay.
Yeah.
And then I think that may answer Michael's question, because he
Okay.
asked, why do the thoracic and lumbar sections of the spine not have transverse foramina if it supplies blood to the spine in the cervical area? But it sounds like it's not necessarily as much supplying blood to the spine as it is the brain and the skull, correct?
Yeah, I mean, it does supply blood to the spine. They do supply blood to the spine as well, but I think the brain tends to be like the first thing that you say, just because it's, your brain is most important. People kind of think first. But the reason why they're not found in the thoracic and lumbar region is because you have other blood vessels supplying those areas that do not run along the spine. And you have other vessels that supply blood to the spine area. Yeah.
It's just really so that effectively they're just not needed in a way.
Yeah. Yeah.
All right. And then this last one comes in and asks the question, do the vertebra go through the bone remodeling process like other bones do?
So what modeling
They
process?
said they referring to a bone remodeling process. So I guess I'm assuming kind of like evolution and fusion, maybe?
I think it's referring to like osteoblasts, osteoclasts, that kind of thing. I would say yes. So I would say to a point, but yes.
Okay.
The answer is yes.
All right, that clears out the questions.
Okay. So now I'm going to get into kind of more of a little bit of an activity. So I'm going to stop sharing my screen and also stop blurring out my background, and we're going to identify some bones. So, well, hold on. There we go. So I'm in the anatomy lab, well, one of the rooms at UNL. So first I'm going to start with the sacrum bone. And again, use the chat if you want to guess. So first I'm going to show this bone here. These are all real bones that I'm going to show. So this is a sacrum. Yep, good job. Sacrum. And in my other hand, I'm also going to show a sacrum. So this is a sacrum as well. So you can see in one hand, we have a more larger sacrum. It's also longer, and it's a little less curved. And then in my right hand, we have a shorter sacrum. And if I move it to the side, sorry, it is more curved. Yeah, so the one on the right, some people said it. Yep, the one on the right is a female, and the one on the left is a male. So males have longer sacrums, less curved, and females have shorter sacrums and more curved. So that's an example of like real life bones. I can show you some other ones too. So this is a male as well. It's just a lot smaller, just a smaller scale, but it's the same amount of curve and just a smaller scale. smaller person. And then here are some more examples of a female sacrum. These are just a little bit more exaggerated. So there's a really exaggerated curve of a sacrum. Again, characteristic of a female. And then here's another example. That's like very curved, yeah. Just unique, different bones. So that's I think that's really cool. And then you'll notice that on the sacrum, I mostly showed this is the anterior view of the sacrum. And more of the anterior view, you can tell it's a bit more smooth, but the posterior view has a bunch of texture and different structures there. So that's a pretty key way to tell the difference between an anterior and posterior view of the bone. All of those structures are on the posterior side. And those structures, so for example, this ridge here, or crest, that is remnants of the spinous process of those vertebrae that used to be separate and then fused during adolescence. So you can see the remnants of those vertebrae, and now it's just one bone. So that's why the posterior side is more textured. It's because you had those spinous processes, whereas the anterior view just had like the body, so it's more smooth. So now we're going to look at some of the vertebrae. Sorry, I'm making some noise. So we did this a little bit earlier, but this is another real bone that we have. Can tell. Yeah, good job. Good job. This is the axis. So this is C2. The most distinguishing feature of C2 is that odontoid process, or dens, and that's going to be on the anterior, more superior side of the bone. And it was difficult because on the PowerPoint you just saw it like this, so it wasn't very defined. But once we show it from the lateral and posterior view, you can see it really sticks up. And you can see the transverse foramen on this side and this side, and those are where the vertebral vessels will run. Okay, next I'm going to show this bone. So we have the anterior and posterior side of this bone. This bone has a body like all of the vertebrae. I would look at the superior articular facets. These are pointing posteriorly. We don't have any transverse foramina on the lateral sides. So this is not a cervical vertebrae or vertebra. This would be thoracic. Yep. So this is thoracic because those superior articular facets are facing posteriorly. And then I'm going to show that compared to a lumbar vertebra. So here we can see the lumbar vertebra, and the superior articular facets are facing more medially versus the thoracic face posteriorly. So that, I would say, is like a key feature. This is a pretty large thoracic vertebra, which means it was probably more of a higher number. So like T10, T11 versus like T1 versus T2. Those are going to be smaller. And then this lumbar vertebra is pretty close in size. So this lumbar vertebra would probably be like L1, L2, if that makes sense. Versus L5 is going to be a lot larger. And then I'm going to show another example. So this was a thoracic vertebra that we looked at earlier. This is another thoracic vertebra. So this is the difference between a lot larger more higher number versus a lot smaller, lower number. So those superior articular facets are facing posteriorly in both cases, but the size difference can help us determine maybe where in the spine we can find them. These also come from different people, so that could contribute as well. And then I'll also show this bone. So this is that other really unique cervical vertebra. Yep, good job. This is the atlas. Remember, T comes before X in the alphabet. The atlas is the first C1. It's the first cervical vertebra. We have those transverse foramina with the vertebral blood vessels running through. And we don't have a body or spinous process on the atlas. One thing to note, so the superior articular facets, you can see them here and here. Those are on the superior surface of the bone. And as I mentioned earlier, on the opposite side, you'll find the inferior articular facets. So these would be the interior articular facets. Facet is always like a flat bone marking, a very flat structure. And it's where one bone will articulate with another. So the atlas itself, the superior articular facets of the atlas will articulate with the occipital condyles of the occipital bone of the skull. And then the inferior articular facets of the atlas will articulate with the superior articular facets of the axis bone. And these bones don't exactly line up. They weren't from the same person, but this is kind of how it looks like. The atlas and axis together. The atlas and axis together, those two bones, the dens and the articulation between those two bones allows you to shake your head like no, versus the articulation between the atlas and the skull allow you to move your head up and down like you're nodding yes. So I think those are kind of some fun facts on that. And then I will also show. Okay, now I'm going to quiz a little bit on some different bones. So what is this bone right here? It has a little chip in it over here, but what would this bone be? I'm getting answers kind of all over the board. So key thing we're going to look at are the superior articular facets, and they are facing medially. That might help a little bit. Yep, so that would be a lumbar vertebra. Good job. Okay, now I'm going to give you another one. Face it in a different direction. So these guys, again, you're going to look at the superior articular facets, and they are still facing medially. So this would also be a lumbar. And then, let's see. How about this bone? Yep, that is a thoracic. So you have the superior articular facets pointing posteriorly. The cervical vertebrae are going to have the transverse foramen, transverse foramina, which are the holes on the sides. So this kind of broken on one side, but the holes on the sides are characteristic of the cervical vertebrae. So this bone is actually just a general typical cervical vertebra because it has a body. So it's not going to be the atlas because it does have that characteristic body. And we see it has a process on the posterior side. All right. So that is all I have for the sacrum and vertebrae. Does anyone have any questions?
Yeah, Sarah, there's two sitting here.
Okay.
And the first one is from Kathan. And the question is, would fractures be different in the pelvic girdle compared to how other bones fracture? And they're thinking along the terms of like green stick or a spiral fracture when the bones break.
It depends on the injury. So it really depends on the injury. I think people can do crazy things to their bones. I would say the os coxa bones, so the bones that make up the pelvis, are irregular bones and they're a lot, I don't know, larger. They're also not long bones, so you're not going to have that characteristic like break in the middle with the sharp edge like going through the skin, that kind of thing, of a green stick fracture. So it's going to look a little bit different, but yeah, you can still have the same types of fractures.
Yeah, they can still kind of break and be displaced, but it all
Yeah.
just stays within the pelvic girdle. They don't
Yeah.
necessarily break through like a compound fracture or something.
Or compound fracture, sorry, yeah. I would say a green stick fracture is probably more unique to a long bone just because it's the green stick fracture is like the bending of a bone. And that's just more unique to a long bone. I wouldn't say that the os coxa bends, but
Okay.
definitely compound fracture for sure. Yeah.
All right. And then last but not least, sitting here, Kimberly asked, do people get more variations in their bones when they're younger or when they're older? So I think she's looking at like, do our bones kind of wear on us and more stuff happens?
Yeah, I would say when you're older. So all of the bone markings can be unique from person to person. So especially the bone markings that are muscle attachments and ligament attachments, those can be way more defined or not as defined depending on the person. So if you're someone who works out all the time, you have huge muscles, you're using them, your bone markings for those ligament and muscle attachments are going to be way more defined. So if you find a bone that is very textured and has very prominent structures on it, that is probably someone who had more defined muscles, especially on like a femur or something like that, where you have a lot of muscle attachments. And then I would also say that as you get older, you may be more likely to have different kind of clinical conditions. So like osteoporosis or something like that. That would change kind of more the internal portion of the bone. So making your bone more porous. And that's definitely more common as you age versus children don't really get that. So yeah.
Okay. And when we were talking, Priya put this one in, and she's looking for tips about memorizing the muscles and their insertions and origins. You got any tricks or ideas on how to make that process go a little bit easier?
Yeah, I get this question all the time from students because they have to know all the muscles and origins, insertions, and actions. I would say the best thing to do is think about what happens when the muscle contracts. So when a muscle contracts, it's going to shorten. So when a muscle shortens, think about what movement that muscle will cause in the body. So for example, so my biceps brachii, the upper arm muscle, if that muscle contracts, it's going to shorten and it's going to pull my arm up. It's going to flex my arm. So think about what happens when that muscle shortens. That will help you with the actions of those muscles. In terms of the origins and insertions, I would say generally looking at a image of a skeleton, and I think what would really help is drawing out those muscles yourself. Attaching to those origins and insertions is super helpful. So I like to use different colors and draw out the muscles on like a printed out skeleton or something like that. That really helps me to think about, okay, I used blue for, the rectus femoris muscle. And then I think about, okay, where do I remember the blue? Okay, this was on, this bone and this bone. So something like that, I think drawing out and labeling yourself is always way, way, way helpful. And then one more thing I would say is just a reminder that the origin of a muscle is always going to be closer to the point of attachment or the center of the body, and the insertion is going to be further from the attachment point or away from the center of the body. So if you have to take a guess, make sure to take that into consideration.
Okay, great tips there. All right, and guys, we've got time for one more question in addition to this one. So if you got anything else, throw it in so we can get one more new question coming in. But while we're waiting for that, Kimberly asks, are the bones of people who are active weaker or stronger than those of people who are not active?
Stronger for sure. Stronger for sure. So stay active and drink your milk.
All right. Okay. Anything else, everybody? We got time. We can squeeze in one more question here before we gotta let Sarah get back to her day. And I think it's probably getting close to dinner time, right?
Yeah. Yeah.
All right. Then just if you guys would please, thank Sarah. Sarah, awesome presentation, so glad you could do it for us and love getting to actually see the samples and the variety of things. As a reminder to everybody, you will be getting a link to the recording, plus we're going to post it to the Science Olympiad TV channel. And just I'm going to put a plug out there. Next week, we have 3 webinars dealing with events. So on Tuesday night, Noah is going to be talking about meteorology and answering meteorology questions. On Wednesday, we have another professor from UNL who is going to be talking about grasslands and helping with the ecology event. And then on Thursday, the original Codebuster himself, John Tobes from North Carolina, is going to be doing a session about Codebusters and tips and tricks for helping you do Codebusters. So if you haven't signed up yet, you can sign up for those on the Science Olympiad workshops page. So Skina, that's where we put the Science Olympiad workshops up. You can find them on our webpage, soinc.org/workshops. There's a listing and you can click there for registrations. The other place the other way you can keep up to date and follow what we're doing is, if you haven't done so, please, I'd encourage you to sign up for our Instagram page, because we're putting a ton of stuff out on Instagram, and there's an ongoing list of webinars and opportunities posted on Instagram. But anything else? Just again, Sarah, thank you so much, guys. Wish you the best of luck on the rest of your season, and hope to see you guys at a tournament somewhere. So have a great night and good luck.
Thank you, everyone.